right. You ready?
Yep.
Okay, good deal. All right. Hey, everybody, and welcome to this interview with one of my lovely patients, Briannca. And so, Briannca came to me. She found me. Was it TikTok that you found me?
Yes, TikTok.
Okay, so that seems to be where everybody's coming from these days. And so, she reached out to me and, she booked a call and we kind of went through everything. So I'm going to let Briannca share her story, where she was when she came to me, what she was looking for, and what she had tried in the past, what wasn't working, and then what we did and where she's at now. So I'll let you take it from here, Briannca.
Okay, well, my name is Briannca. I'll be 30 actually in a couple of days, so 29 years old. And I had actually started dealing with some what felt like neuropathy. Kind of started freaking out because I wasn't sure what was going on. Kind of going down that rabbit hole, trying to figure out, am I actually having neuropathy? Going to the doctors and they're telling me, everything looks fine, doing nerve testing, um, testing for autoimmune conditions, and nothing came back. So I really was just lost. So I got on TikTok, of course, and started just scrolling, just typing in neuropathy, um, how to cure neuropathy and things like that. And I came across Dr. Strong's page. And so I watched a couple of his videos, probably for about, I would say maybe 3 or 4 weeks. I watched some of his videos and then I finally decided to reach out. So got in touch with him. He was super responsive. And then we started on the program. So what was your other question? I'm sorry.
Yeah, so no, that's perfect. So it was you've been to all these doctors and you feel like you have neuropathy, but all your
Mhm.
tests are coming back clear. And I think that
Yeah.
this is such an important point because there's kind of like traditional neuropathy like I told you where that's usually with diabetics, chemotherapy, radiation therapy is that's also if you've had like some sort of spinal injury or trauma,
Mhm.
you're smokers or drinkers, but when we went through and worked through your health history, it was like none of that was present.
Yeah, nothing. No risk factors for neuropathy, especially at my age. So that was very odd to me.
Yeah, and I think this is something, we're unfortunately seeing in younger people is that they have these symptoms that seem like neuropathy, but no risk
Mhm.
factors. And that's, where we really have to ask the question, well, what is going on? So
Mhm.
then we kind of dove into your history about like gut health and we started talking
Mhm.
about just inflammation and stress and food and those sorts of things. And so, was that kind of eye opening for you? Like, well, hey, I don't have these traditional factors. Maybe this is just like a systemic inflammation. Maybe it's stress because you have a pretty stressful job, and we kind of talked
Yeah.
about that and some other
Mhm.
things. So, transitioning. What was kind of like the spark that you were like, okay, maybe this guy knows what he's talking about.
Yeah, honestly, because I exhausted all of my options at that point. There literally couldn't be anything else. And I had dealt with some, gut issues before, but it never led to, kind of that neuropathy feeling.
Mm-hmm.
So, not experiencing that before, I still was just kind of on the edge. So at that point, I'm like, what else do I have to lose at this point? This guy seems to know what he's talking about. So just give it a try, and it worked. So
Yeah.
yeah.
And so you had done some like gut stuff in the past and kind of
hmm
worked through that. What do you feel like was the difference between working with me and like what you had done in the past?
Yeah, so in the past, I've done stool testing and I've done food allergy testing. And so the protocol that I was on before, they test for all these different things going on in your gut, and they send out these different herbs to you, and they want to treat exactly what they find in those results. But I think with your approach, you kind of started from the beginning. Okay, let's try to break down this bacteria, let's clear everything out, reintroduce the new bacteria, all the good things for your gut. And I think, starting from the beginning and kind of working your way through the process instead of just, I don't want to say throwing things at it.
Mm-hmm.
Um, kind of gives you a good foundation to, better your gut. So I think that's the difference, with your protocol.
So, like what you're saying is like we did more of like a complete reset rather than just trying
Yes,
to address these specific things. It's like
exactly.
let's just clear out your system. Let's address
Hmm.
any potential errors. That way, we're not coming back and having to address something later. It's
Yep.
let's clear out everything. And so, what going through, because I think we've been together almost 4 or 5 months, something like that
Hmm.
now. And so, what's kind of been like the biggest? Oh, and then can you tell everybody like what your symptoms were, like the neuropathy, because maybe not everybody knows.
Yeah, so I was having kind of like these burning sensations, just random places throughout my body, and what also felt like skin crawling. So the only thing that I could think of, like pins and needles, skin crawling
Mm-hmm.
type of feeling. So the only thing I could think of was neuropathy. So it freaked me out. But yeah, those were the symptoms that I was having.
Got it. And what was going through the process, because we were talking and kind of going through what was like the most beneficial thing that you got through going out through this process of like learning about different foods and how they affect you? Was there
Mhm.
anything? Because I think coffee was kind of like one
Yeah.
thing, right? And so,
Yep.
what were some like other things that you got from this?
So just to add to your point about the coffee, I am someone who deals with stress.
Mm-hmm.
So I noticed that anything that would trigger like my nervous system, like coffee, or anything with caffeine in it, that would,
Mm-hmm.
cause symptoms. And also gluten for sure
Mm-hmm.
was a big trigger for me. So just learning to not really go on a diet, but really try to eliminate those things from my diet because I could actually see that they were causing problems for me. Even dairy is hard for me to do. So just really trying to stay away from things that I noticed were causing issues. Um, and it helps.
Yeah, and I think that
Mm-hmm.
that's something that maybe um, other doctors they just kind of give you generalizations, but we went through like some testing with these foods to see,
Mm-hmm.
and it was all at home. Like you weren't having to do blood work or anything like that, but it was kind of giving you this information. Hey, like your
Mm-hmm.
body's responding to this in a certain way that's causing inflammation. And so,
Mm-hmm.
what I see is that looks different for everybody, and that's why we go through like kind of this. I wouldn't say it's rigorous, but maybe it is a little rigorous. Did you find it
Mm-hmm.
hard or anything like that?
It was challenging, only because you get used to eating certain things,
Mm-hmm.
and then of course the doctors are telling you, okay, well you need to eat your dairy, you need, to try to have
Yeah.
a well balanced diet, but certain things don't work for everybody, so you really have to listen to your body, and see how you're feeling, and if you feel like things aren't working for you, whether that be nerve pain or digestive issues, you really should avoid it.
Exactly. And so it's more of like an intuitive dieting. Like you're
Yeah,
not really limiting yourself, it's just figuring out what works for you and gives you
exactly.
the fuel and energy. So, where you started and where you're at today, can you kind of tell
Mhm.
everybody what that looks like or how that's different?
Yeah, I would say now I am definitely feeling a lot better than I was when I started. Really just kind of feeling hopeless at the beginning, not
Mm-hmm.
not knowing like what the future would be, doctors really not doing anything. So I would say now doing a lot better. I do not have the symptoms that I was having when I started, 4 or 5 months ago. My diet is better. I'm feeling a lot more, I would say more energy just because, I'm getting rid of things that don't work with my body. Still exercising and doing the things I need to do. Like I mentioned, for me, I do carry a lot of stress, so I try to do just low impact exercises like Pilates and just walking and things like that. So I think a combination of all of those things really do help.
Right. And this was something that I thought was interesting because I think I made a video about exercise. And I think you
Mm-hmm.
messaged me and you were like, I used to be going hard in the gym all the
Yeah.
time. And so
Yeah.
we talked about that. I think it was kind of like indirectly. It was just like you saw my video about it and then you're like, I was doing all this hard work and it was almost like you were getting like a double stress effect. It's like
Yes.
life is
Yep.
stress and then you're kind of like
Mm-hmm.
stressing in the gym and I think that that's for some people, they don't understand. It's like you think you're doing a healthy thing, but if you're doing it
Hmm.
too much and stressing
Yep.
yourself out about it, it can be a bad thing.
Yeah, especially if your nervous system is already out of whack, it doesn't help at all. So I did notice a difference, just kind of slowing down with my exercises. That helped a lot for me.
Yeah, perfect. And so somebody who's watching this right now, and maybe they're kind of where you were when you kind of reached out or was contemplating reaching out. Is there any like piece of advice that you would give yourself or somebody who's viewing this video about, you know, what to do or kind of just maybe take that leap? What would you say to them?
Hmm. Honestly, I would say that if you're in the situation that I was in, definitely try to do some research. I don't want to say don't listen to your PCP, but sometimes you really have to look deeper.
Hmm.
And try to find the root of what your problems actually are. So I'm learning that everything is not always surface level.
Hmm.
So really just do your research, find somebody that you trust, and just take that leap. It's like for me, I was at the point where I didn't have anything else to lose, so it was worth trying, and I'm so glad I did, and it worked out for me.
Great. Well, thank you so much for sharing your story. And it's
Mhm.
been so great to get to know you and work with you. And I really enjoy getting to know my patients and hearing these stories. So thank you so much for sharing this.
Thank you. I appreciate all of your help so much.
Perfect. Thank you.